Thank you. The first time I stood up in front of a very big audience of health and social care people from the statutory and the voluntary community social enterprise sectors was in 2007. Some of you will remember that in that year the Audit Commission came to Greater Manchester because they were a little bit concerned that we had the lowest life expectancy and the worst health inequalities in England, and they published a report. We all got together and we all signed a pledge. Is anybody here now who remembers signing that pledge? Excellent, I thought so. And we promised that we were going to work together to change that and to turn that picture round. Now, this is a sentence you won't hear uttered very often, but I wish the Audit Commission was still alive, because I would love them to come back and see how much has changed in that time. So, okay, we haven't yet made a massive dent on health inequalities in Greater Manchester, but I think back in 2007, when we all signed the pledge, it was in a spirit of wanting to do it, that we knew we had to work together to do it, but I think we had very little idea really of how that might happen, and I think that has changed. And I think just listening to the speakers this morning on the podium, talking quite naturally and quite passionately about how we are all part of the same system and we're all part of the solution and how we are going to all be working together on this, that's enough illustration really of how much has changed. In May this year, the Greater Manchester Health and Social Care Partnership and the voluntary community social enterprise sector of Greater Manchester signed a memorandum of understanding. It is an extremely radical document. It's based on the VCSE review that was undertaken by Department of Health a year or so before that, and it goes a little bit further than that, and it sets out very clearly exactly how we're going to bring together the two halves of the health and social care system and solve some of the problems that we're all only too well aware of. We should all be very proud of the agreement in itself. Has anybody seen the agreement? Who knows the agreement? Oh, that's good as well. We're getting it out there and people are aware of it. If you haven't seen it, do please go onto either the partnership website or GMCVO website. You can find it very easily. And we have even got an easy read version, which is only 2 sides long and tells you everything you absolutely have to know. The agreement sets out some common goals that we're all determined to work towards. And it also sets out the kind of methodology for working, which quite clearly embeds VCSE people and leaders within every aspect of health and social care transformation. So over the last year or so, really, people from our sector have been progressively working much more closely with people from the public sector, all parts of the public sector, on every aspect of transformation, right through from kind of beginning to think about how do we solve a certain problem, through to design and development of strategies, principles, services, the emerging LCOs, the ways in which things will be evaluated and monitored, and right up to governance level. It is very early days, and I think people keep saying that as well. I think 10 years' work is still early days, to be honest. But if you look at how things have already changed over this very short period, I can already feel that culturally both of our sectors are shifting to accommodate the idea that we are going to have to be, I think, quite challenged as organisations and as sectors to drop the boundaries, to drop the kind of organisational status, and to try to all work in a very different way. It matters. We have got an enormous voluntary community and social enterprise sector in this city region. We're blessed with it. There are between 15 and 16,000 groups. About 77% of those earn less than 10,000 a year and are completely rooted within the community. Between us, we provide 1.1 million hours of formal volunteering every single week. And our sector brings to the table a lot of knowledge and understanding of how communities are. They are composed of the residents of Greater Manchester and the communities of place of identity and of interest across the city. And we bring a lot of our own resource in the form of grants, donations, traded income, as well as the volunteering component. We bring a lot of knowledge and wisdom and a different way of doing things. So as a sector, we are very well organised. We're quite capable of mobilising on a city-region footprint, locality or smaller, and on thematic footprints. And the way we do this is through what we would call a collaborative and distributed leadership model. So, okay, GMCVO is the sort of generally seen as the figurehead of that, but there is, with GMCVO, we are working as part of what we're calling the VCSE Devolution Reference Group, which is a mixed group comprising infrastructure leaders and frontline organisations to provide a kind of visible point of leadership for our sector. And we are connected through those organisations to pretty much the whole of those 16,000 groups. We can coordinate, we can collaborate. We want to work with you. Please come and talk to us. I'm not Tony Walsh, and I'm not trying to write poetry, but I want to steal somebody else's words. This is a poem by John Agard, who some people may know. He's a British resident, but born in Guinea. River be their teacher, that together they may turn their future highs and lows into one hopeful flow. Two opposite shores, feeding from a single source. Mountain be their milestone, that hand in hand they rise above familiarity's worn tracks into horizons of their own, two separate footpaths dreaming of a common peak. Birdsong be their mantra, that down the frail aisles of their days their twilight hearts twitter morning, and their dreams prove branch enough. That's as close as I can get to saying how I hope things are going to go from now on. Thank you very much for listening.